Good afternoon. We have heard about the desperate need for breakthroughs in psychiatry, and what I will be discussing with you, I am hopeful, may very well lead to some breakthroughs in the mental health field. As you all know, we have a crisis in the world today. Mental disorders are on the rise, and they are now the leading cause of disability on the planet. Although we have many treatments to offer, they fail to work for far too many people. Why can't we do better? At the end of the day, it's because no one can definitively answer this question: what causes mental illness? Instead, we know some of the factors involved, and we lump them into biological, psychological, and social factors. We talk about neurotransmitters, genetics, hormones, trauma, neglect, stress. How do these all fit together? No one knows. That's where I was as an academic psychiatrist until 2016, when I had the good fortune to help a patient lose weight. The patient was a 33-year-old man with schizoaffective disorder. He had daily hallucinations and delusions. He was tormented by his illness. He had tried over 17 different medications, but none of them worked. This man gained a lot of weight from those medications and asked for my help to lose weight, and we decided to try the ketogenic diet. Within 2 weeks, not only did he begin losing weight, but I began to notice dramatic reductions and changes in his psychiatric symptoms. He was becoming less depressed, making better eye contact. Most astonishingly, within about 6 to 8 weeks, he spontaneously reported to me that his long-standing auditory hallucinations were going away, and that his paranoid delusions were also going away. He began to realize that they weren't true and probably never had been. This man went on to lose 160 pounds and keep it off to this day, and he was able to do things he had never been able to do since the time of his diagnosis. He was able to go out in public and not be afraid. He was able to complete a certificate program. He was able to perform improv in front of a live audience. I was dumbfounded, and I went on a search to understand what on earth just happened. For those of you who don't know, the ketogenic diet is a diet that's high in fat, low in carbohydrate, and moderate in protein. You may have heard of keto as a dangerous diet or a fad diet, but in fact it is an evidence-based treatment based on numerous randomized controlled trials for weight loss, type 2 diabetes, and most interestingly to me as a psychiatrist, for epilepsy. The ketogenic diet can stop seizures even when medications fail to. And this was particularly important to me as a psychiatrist because we use epilepsy treatments in psychiatry all the time. Medications like Depakote, Tegretol, Lamictal, Topamax, Neurontin or gabapentin, Valium, Klonopin, Xanax. You all know those names. Those are anti-seizure treatments. And in fact, we have decades of research identifying the molecular pathways of how this diet stops seizures. And in fact, these pathways have direct implications in people with chronic, serious mental disorders. Armed with this information, I began using this treatment in dozens more patients, but I was not alone. I was joined by researchers and clinicians from around the world. The largest case series we have is 31 patients with treatment-resistant mental illness, schizophrenia, bipolar disorder, and chronic depression. They were all admitted to a French hospital and started on the ketogenic diet. 28 of those patients were able to do the diet. Of the 28 who were able to do it, 100% had at least reduction in symptoms, but 43% achieved clinical remission. The majority of patients were discharged on less medication than they went into the hospital on. In case you're thinking, well, this must be a fleeting response to weight loss, I want to tell you another story. And this is the story of a woman named Doris. Doris was 17 years old when she was diagnosed with schizophrenia. She began having daily hallucinations and delusions. Over the ensuing decades, Doris tried numerous antipsychotic and mood-stabilizing medications, but they didn't work. They did cause her to gain a lot of weight. Doris was tormented by her illness, and between the ages of 68 and 70, she tried to kill herself at least 6 times. At the age of 70, weighing 330 pounds, she was referred to a weight loss clinic at Duke University where they were using the ketogenic diet. Within 2 weeks, not only did she begin to lose weight, but she reported dramatic reductions in her chronic auditory hallucinations. Within months, her symptoms of schizophrenia were in full and complete remission. Within 6 months, Doris was off all antipsychotic and psychotropic medications and remained in full and complete remission. Doris went on to live another 15 years, medication-free, symptom-free, out of psychiatric hospitals, no longer seeing psychiatric professionals, no more suicide attempts. When I last talked to Doris, she said she was happy to be alive, and she wanted me to share her story far and wide in the hopes that it might spare even one other human being the suffering she endured for over 50 years. Sadly, Doris passed away this past January at the age of 85 of COVID pneumonia. For those of you who are ready to rush out and try the keto diet or put a loved one on the keto diet, please understand this is a serious medical intervention. It is not a diet. It is a serious medical intervention, and serious mental illnesses are serious. They require competent medical care. So please do not do this on your own. But I didn't stop there. I was fascinated. Schizophrenia is not supposed to go into remission, certainly not off medications, and certainly not from a diet. So what can these cases tell us about the cause of mental illness? And for the last 6 years, I have been, some would say, obsessed with this topic. And I am going to take you on just a tiny glimpse of that journey now. And it starts with this connection between what we call mental disorders and metabolic disorders. So it turns out that mental disorders have strong bidirectional relationships with metabolic disorders, obesity, diabetes, and cardiovascular disease. I include Alzheimer's on this list. You may be surprised, but for those of you who don't know, obesity in midlife, type 2 diabetes, cardiovascular disease, and its risk factors are all the strongest risk factors for Alzheimer's disease. What do I mean when I say bidirectional relationship? I mean that if I look at a group of patients with mental illness, they're more likely to have these other diagnoses. If I look at any group of patients with any of these diagnoses, they're more likely to have mental illness. Let me walk you through just a snapshot of the data. People with mental disorders, depending on the study and the meta-analysis, anywhere from 30% to 300% more likely to have obesity. People with mental disorders, about twice as likely to have diabetes, more likely to have cardiovascular disease and die an early death from it. People with chronic depression, 2.5 times more likely to develop Alzheimer's. But get this, if you have schizophrenia and you live to the relatively young age of 66, you are 20 times more likely to also be diagnosed with dementia on top of your schizophrenia. What about the other way around? People with obesity, anywhere from 25 to 75% more likely to have a mental disorder. Diabetes, 2 to 3 times more likely to have a mental disorder. Cardiovascular disease, 3 to 5 times more likely to have depression. Alzheimer's disease, for those of you who don't know, almost 100% of patients with Alzheimer's disease have mental symptoms, depression, anxiety, personality changes. 40 to 50% have auditory hallucinations or delusions. Those are the hallmark symptoms of schizophrenia. So think about it. If you have schizophrenia, you're 20 times more likely to get Alzheimer's at an early age. And if you develop Alzheimer's, there's a 50-50 chance you're going to get symptoms of schizophrenia. We cannot talk about root causes of mental illness without talking about root causes of these other disorders. And in fact, this is nothing new. The mental health field has identified metabolic abnormalities in the brains and bodies of people with mental illness since the 1940s. We have a plethora of basic science research. You know all those neuroimaging studies that we're doing, SPECT scans, PET scans, functional MRI. Guess what they're measuring? They're measuring brain metabolism. Diagnoses include depression, anxiety, PTSD, schizophrenia, bipolar, anorexia, alcohol use disorder. What do I mean when I say metabolic problem? I mean differences in the levels of lactate, glucose metabolism, the ATP to ADP ratio, reactive oxygen species, inflammation, brain insulin, mitochondrial function, on and on. Now, many of you are thinking, well, it's the pills we prescribe. The antipsychotics cause metabolic problems. And make no mistake, they add insult to injury. But these connections, especially the connections between serious mental illness and diabetes, have been known since the 1800s, before those pills were even invented. And this longitudinal study speaks a different story. It says that metabolic problems may precede serious mental illness. A longitudinal study, 5,000 children, followed from the ages of 1 to 24. Those with the highest insulin levels beginning at age 9 were 5 times, that's 500%, more likely to have a psychosis at-risk mental state, and 3 times more likely to already be diagnosed with bipolar disorder or schizophrenia by the time they turned 24. Children who gained the most weight around the time of puberty were 4 times more likely to develop depression. So I'm talking about metabolism, metabolic disorders. What is metabolism? It's more than burning calories. It is the process that all living organisms use to convert food into energy or building blocks used to maintain or grow cells, and it involves the management of waste products. It is extraordinarily complicated. There's so much we don't know about it, as illustrated in this graphic. And metabolism is fundamental to the definition of life. So from this stance, well, duh, Chris Palmer. Of course, mental disorders are related to metabolism. What isn't? But when we begin to ask common sense, big picture questions, well, what controls metabolism? What regulates metabolism? What does it actually mean to have a metabolic disorder? What does it mean at the cellular level? We begin to get answers. And those questions lead us to mitochondria. Many of you have heard of mitochondria as the powerhouse of the cell, but I am here to tell you they are so much more than that. They are critical players in metabolism. There are hundreds or thousands of them in each cell. And in fact, I am here to argue that mitochondria are the unifying link of all of the factors known to play a role in mental illness. All of the factors listed on this slide directly control the function of mitochondria, and/or mitochondria directly control these factors, including neurotransmitters, epigenetics, inflammation, the gut microbiome, diet, exercise, adverse childhood events, stress, trauma, drugs and alcohol, sleep, hormones. The only way we can connect these factors is through mitochondria. So what causes mental illness? I am here to boldly and audaciously, and some of you may think stupidly, claim that mental disorders, all of them, are the result of metabolic and mitochondrial dysfunction or dysregulation. But we have many treatment options, more than just the ketogenic diet. There are other dietary strategies that can be used. There's exercise and sleep, the gut microbiome. Medications play a role, hormonal imbalances, stress reduction, managing substance use. Where do we go from here? Well, numerous researchers have already been pursuing this for decades, and they will continue advancing this field. But thanks to the generosity of the Bazooki family, Jam Bazooki's right here in the audience, we now have a metabolic psychiatry research group composed of dozens of neurologists, basic scientists, psychiatrists, mitochondrial and metabolism experts who are all collaborating. We have at least 5 controlled trials of the ketogenic diet for serious mental illness underway. In November, I will be publishing a book, Brain Energy, that outlines the science of all of this. And together, I ask for your help. Let's transform mental health care. Thank you.